there's no form of psychosocial support, no psychological support. And I think people are so busy with the outbreak that those are areas that they actually forget. And it only came maybe to be realized after an 18-year-old committed suicide, in a holding facility. They were just collecting blood. They went from one room, and then when they went to the next room, they went back after 10 minutes, and this guy had hung himself, and had hung himself with in a room with other patients. So that's when it was realized no one counsels these people. There's so much stigma, and children have lost their parents. And you can find maybe in a household that maybe there's maybe one child left, there's the mother left, the father left, and people are devastated, but no one ever looked at that aspect, and no one is really bothered because they are busy with other things. So I think it's very important that you touched on maybe some form of psychosocial support during the outbreak and after the outbreak. Yeah. Before the centers were set up, people maybe did have some fear about the centers and all, but now the problem is because there are not enough healthcare workers. I'll speak about Sierra Leone, I'm not sure about the other countries. There are not enough healthcare workers. So to complement the staff, they've taken what we call volunteers. They've taken people from the community. These people are illiterate. Most have not gone to school, but they've promised them $100 a week as a risk allowance. Yeah. So you've got the centers. So those people are working there as sprayers, they're working there as cleaners, they're guards, okay, minimal risk. So everyone who goes into the red zone is given the $100, including the nurses. So these people are only given 3 days training. And we're talking about people maybe who have never worked maybe in a healthcare facility, so you just give them the basics. They do not know, the reasons they're doing things. You just tell them, no, you're going to dress like this. When you clean, you're going to clean like this. But they do not know, maybe even the basics or maybe of microbiology, because there's not enough time. So after that, we take these people, we put them there, and then they start to work. They're not working because maybe it's my community. They're working because they want the money, because most of them are very poor. So in that respect, and people are actually fighting to work in these areas. So that's when maybe some of the stigma fell away, because everybody wanted to work in these areas so that they could get some money. But before the establishment of the CCCs, there was a problem. Stigma was a problem, even with families. But now, because there's some monetary gain, everybody wants to work in these places.
Also, psychosocial support, which is very important. So, desired situation would be to cover particular groups of population with psychosocial support. We have numbers of people who died in community, number of orphans, number of widows. Then we can have the exact number in particular community. What is coverage of psychosocial support to these people? Did we cover everything? Did we cover all or not? And what prevented us to do that? So in recovery period, psychosocial support is important. Going also with, we didn't mention in first round, stigmatization, which is important in community. To avoid stigma, because these people who suffered and survivor, they have to come back to community, to normal life. And also, as we said, with restarting gathering in cultural activities, sport activities, we can measure how many concerts did we have after the outbreak, how many football match happened after the outbreak in recovery phase. So it's a kind of process of normalization.